Welcome back to your OncoCare Advisor. This is Dr. Raghav here. Recently, I had someone who presented to us with anemia while she's undergoing chemotherapy for lung cancer. So, anemia. Let's talk about the blood work that happens during the cancer treatments. CBC, which is the complete blood count, is one of the tests we do on a regular basis. Anemia is defined by reduction in what we call a hemoglobin. So there are different components to it. You will see something like red blood cells, you will see something called hemoglobin, and there are other things like MCV, MCH, MCHC, and RDW. You don't need all of them. Let me break it down. If we talk about anemia, the most important thing you want to see there is hemoglobin. And it goes in line with hematocrit. They both are kind of correlating with each other. A couple of other things we could look at is something called MCV. MCV represents the size of the red blood cell. If it is smaller or if it's larger or if it's normal size, kind of gives your doctor an indication what may be the reason for your anemia. So hemoglobin, hematocrit, and MCV are more than sufficient. So this person had anemia. Normally, the hemoglobin ranges between 12 to 14 grams, let's say 12 to 15 grams, sometimes a little bit less for females and a little bit higher for males. Her hemoglobin was about 8.5. While typically at that level, we don't jump and give blood transfusion, we first try to understand what is the reason behind that anemia. So when we see the hemoglobin, we look at the MCV. If the MCV is low, I'm thinking more of, could this be related to some kind of an iron deficiency? So when we see anemia in person who's going through chemotherapy, we do take an initiative to do subsequent testing. We test for iron levels, we test for B12, we test for folic acid levels, these are vitamin levels. We also check for something called retic count. Retic count represents how much your bone marrow is responding to the anemia. We check for something called erythropoietin. What it does is, it's a small little protein that is produced by the kidneys. It kind of sends a message to the bone marrow to push to produce the red blood cells. So hemoglobin, MCV, iron levels, other vitamin levels like B12, folic acid, retic count, erythropoietin level, these are some of the basic things we do. If we're thinking beyond that, then we can do other tests like bilirubin, haptoglobin, LDH to see in case if the red blood cells are breaking down. So it's important to understand this because I would not give someone iron replacement just because I see anemia. It's important to know what is driving this anemia. And that helps to manage that hemoglobin while someone is on chemotherapy. I hope this was helpful. If you have any questions on any of the topic we covered today, please DM us here. Thank you.